This movie shows how we can preserve a ridge from atrophy after multiple tooth extractions using a bone graft and a resorbable collagen membrane. When teeth are removed or missing, natural healing and resorption of the bone occurs, causing the ridge to deform. An alternative procedure is a ridge preservation technique. When the teeth are extracted, a flap is prepared to expose the bone. The tooth socket is then filled with a bone substitute. The type of substitute used is determined on a case-by-case basis and may be a synthetic material or another that will stimulate bone growth. The material of choice is used to fill all the voids, including the tooth socket as well as any bone defects. These areas can be covered with a resorbable membrane to further aid in the healing process. The flap is then repositioned, sutured into place. A medical glue can be used over the suture lines as well. The area is then allowed to heal for a period of time. The sutures will be removed or will dissolve if self-dissolving sutures are placed. With time, the membrane underneath the gums will dissolve and the bone substitute will be replaced with the patient's own bone by the body. This treatment will often create an ideal bone ridge in the edentulous area. We can now place implants in ideal bone, or we can have good bone support of soft tissues under other prosthetic options.